So over the past few months, I've been getting calls from nurses and agency owners about what do they do when it's time to move a client out of their agency? How much documentation do they need to do? Because we know most of us keep these clients for just a certain period of time. There's usually a kind of a life cycle to these clients. A lot of times they come to us, they're doing okay, they're up piddling around with their walker. Usually they decline in health. Some of them stay at home all the way until they're bedridden. Others leave home and maybe go to a facility. There's things you need to document there, or some actually pass away and they move away as well. A lot of times people are on our roster and they may move to where their family members are. So there's a lot of in and out of clients. That's why you need so many, so that you constantly have a revolving door, and you want clients constantly coming in because they're going out as well. So that's what I'm going to talk about today, is what is our responsibility as a home care agency for coordinating those services and making sure those clients get what they need when they leave our agencies. So I'm going to look at 3 areas. One of them is the staff participation in coordination, the responsibility of the agency management, and I'll talk a little bit about some coordination activities. I won't cover all of them, but there are a lot that I will cover and maybe give you some examples. So when the staff participates in coordination, it should be based on the needs of the client. The staff may come together to talk about something that a client needs that's new, different, new to the agency, or the client had a status change. So you may have the nurse and the aide and maybe the agency director come together, and they're talking about what this client needs. It could be that you're doing all of the things that you do as far as the ADLs, bathing, dressing, and all of that. But this client may now need home health, which is another agency that would come in and do wound care, medication management, those things that are clearly out of the scope of your agency. So you may see that that client needs some of those services. So the first place your nurse would go is they would let the doctor know that this client has a status change. They would either let the doctor know or the family member and let them know, Miss Jones needs a doctor's appointment. Can you take her to the doctor and speak to them about this or that? It just depends on how urgent it is. And the nurse would really be involved and they would know exactly what to do. And as far as the agency management, the agency director or whomever, they would ensure that there is good communication between all disciplines. And when I say that, I mean the aide, the nurse, and then outside sources. If you brought in another agency, sometimes people are getting physical therapy, occupational therapy, wound care. They're getting those in the home, and we have to coordinate and work with them as they're providing those services, because we have things we need to do and they do as well. So I want to talk a little bit about some of the activities that you may encounter when you are looking at coordinating any type of care for a client. The communication between staff members is so key. That's with everything. And one thing that I like to do in this area is that when I had my agency, one of the key things that I think helped so much with the way things operated was that I always gave the aides report. And that means that once either myself or a nurse did an assessment on the client, we spent time talking to that aide and telling them what really almost anything we knew about the client, who lives in the home, what the home looks like. Of course, if they didn't have directions, now directions are very easy because everybody has GPS. But when I started, you had to tell them how to get there. So you tell them as much as you can about that client, so that on the day that they show up and they meet the client for the first time, they know something. You know, I think it's really unprofessional for an aide to show up at the client's home and go, well, what am I supposed to do? And I think some of them probably would say that if they hadn't been given some precursor information. So that's really important. It takes a little bit of time up front for the nurse to do that, but I think it really saves you in the long run as far as problems that may come up. And then with coordination, you want to be sure that if it's your nurse or if it's your marketing person, they need to be visiting the hospitals and the institutions and building relationships with them. That is one of the things they're going to do. That's from a marketing standpoint. However, I visited hospitals and institutions many times. If the family called me and said, my husband is coming home from the facility tomorrow, if he was still in there, I would take the time and stop by the facility and see what his condition was even before he got home, because that gave me a good leg up on kind of what I was looking at. I did that many times. I'd go in the hospital for just a little bit, not to do a full assessment, but to see what their condition was and how they were moving. And then when they got home, I would complete the home environment part of their assessment. And just keep in mind, you're building relationships for future referrals in these circumstances as well. When you get referrals from other sources, of course, you're building relationships, you're coordinating with them, and those people are a resource for you. I encourage my agencies to keep track of where your clients are coming from, because if you start to go back to those agencies or whatever and build a relationship with them, you start to talk to them, let them know, thank you for giving us that client. They're doing well, this, that, or the other, but you're building a relationship and they know who you are. Also, you will cross refer to them. You may be working with a physical therapy company and they're servicing your client. You may give them a client of yours that needs physical therapy because you know that agency is a great one to work with. So that's building relationships for the future as well. One of the main reasons that we do all of this is we want to arrange uninterrupted care. If that client was at your agency and whatever you did for them, you want to be sure if they moved on, that you had a cutoff and that someone knew what to do for that client when they moved on. A lot of agencies will call your nurse, their nurse will call, and you'll let them know what you did for the client. Some of them will just wait until they come and take over from there. But I always thought it was very nice to talk to the home health individuals about the client and their needs. We could service them a whole lot better when I knew something about them. And then this is a very important area, the use of transfer and discharge summaries. Discharge summaries are so important. And this is something that a nurse can really get behind on, because I often did. You may have a discharge, but you're constantly dealing with all of the day-to-day things. So I would kind of put that information to the side and I say, I'm going to write that discharge note later. Well, sometimes it was much later. So if the nurses could get in the habit of writing a note, and that means where did that client go? Within every client's chart, there should be a discharge summary page. And it talks about a little bit about when you admitted them, but then finally, when they get transferred out of your agency, even if they pass away, someone should make a discharge summary note as to where that client went. This is relevant because if you get a survey from the state, they are going to look at discharges as well. They're not just going to just look at your active clients. They want to see your discharges, because a person has left, and if they look at the discharge summary and they see that they left because they didn't like the aide or the agency didn't answer their questions, or if it was a problem, they can uncover it there. So as you are supposed to keep your records for at least 5 years. So if they come in and ask to see 2 or 3 discharges, if you have those charts up to date, you'll be able to provide it for them. That's basically what I wanted to cover today. It's an area that we usually don't think about, but I think what it does is it helps your agency to run more efficiently All of those resources I talked about in the presentation are potential referral resources. Those are potential partners. You refer to them, they refer to you, and you build that relationship. And you really just feel good about knowing a good home health agency or a good PT agency, good OT. Some of those are all within one agency. But as you build those relationships, those people will probably refer back to you in the future. And that's really key.